Samadi, and a happy Sunday to you.
Same to you. Thank you.
I'd like to pose a question to you regarding elevated PSA readings. About 3.5 years ago, while going for an annual physical, I experienced a rise in my PSA, which led to consultation with you and the eventual and successful robotic surgical removal of prostate. My question is, numerous individuals have asked me what constitutes an increase in a PSA reading or a range in PSA reading increase.
That's a very good question. So PSA, which is a blood test that we use for screening for men, if you look at the labs, basically they tell you that somewhere between 0 to 4 is a normal number. But that's a big range, and I think there's a lot that goes into it because as we get older, the level of PSA should be higher. As you're younger, for example, if you're around 40 years old, we may look at 0 to 2.5 as a normal value. Having said that, I think the size of the prostate also plays a big role because the bigger the prostate, the higher the value of PSA usually. So because PSA is not prostate cancer specific and it's only prostate specific, things such as inflammation, enlarged prostate, and prostate cancer, Larry, can increase this PSA. So in general, I would tell you that if you're in mid-50s, we look at the trend, going back to your question, and with something called doubling time, we look at the amount of time that your PSA doubles. And if it's about a year and a half, I would say that's a very fast-growing PSA, meaning that if your PSA 1 year is 1, the next year is 2, the next year is 4, that means that every year this PSA has doubled, and I would be very concerned, and I would recommend you to get biopsy. The good news about biopsy, Larry, is that unlike old-fashioned random biopsy that we've had, now we have in our office, in our center in Madison Avenue, something called MRI-guided biopsy, and we're the only center in Manhattan with the EuroNav MRI-guided biopsy. What does that mean? We take the images from your prostate with the MRI, and we'll see if there are any lesions, hyperactivity on the MRI, then fuse those with ultrasound images, and then I can basically go after the targeted areas that is sliding up rather than just randomly shooting your prostate and miss the cancer. So if anyone out there has problem with elevated PSAs and are going for biopsy and they want to get MRI guided biopsy, you can call the office 212-365-5000, 212-365-5000, and I'm happy to help you.